right, hello everybody. My name is Rebecca Seratt with UT Extension in Chester County. I'm a family and consumer sciences educator, and I'm happy to be bringing this training to you this evening called Using the Internet for Health and Medical Purposes. And I've kind of subtitled this A User's Guide to Getting and Sharing Credible Information. So as we go through this training, I want to just briefly highlight some of the things that we're going to discuss and hopefully learn about as we move through. We're going to talk about different health and medical purposes for internet use. We're going to discuss using the internet to find information about your health, how to identify credible sources of health information in the digital age, how to avoid sharing misinformation, and practice identifying credible sources. And then I'm going to go through several sites that are recommended for finding health information. So first, let's pause and think, what health and medical purposes do you use the internet for? There's several things out there. A recent story comes to mind that I had a friend of mine. She used the internet because her 2-year-old child was exhibiting some concerning eye blinking, very rapid eye blinking, more than was normal. And by the time this friend got online and researched, why would my 2-year-old be blinking rapidly more than normal, she was convinced that there was just something wrong. Everything that she was reading said there could be neurological concerns or things like that. Well, my friend took her child to the doctor, and the doctor just reasoned, it's basically allergies. So, sometimes using the internet can be a great tool for determining what's going on health related or finding health information. And then sometimes it might lead us down a path that's not really where we need to be headed to find credible information. So I'm sure you probably have similar stories and things, but let's dive into a little bit more about what we use the internet for related to health and medical purposes. So like my story illustrates, we research symptoms or maybe self-diagnose ourselves or others using information we find on the internet. We may have some type of rash that comes up on our arm or a leg or something like that, and we start searching the internet through pictures to see what this could possibly be, or just anything out there that we're not overly familiar with. We kind of start that self-diagnosing of symptoms. We also use the internet to find healthcare providers. Maybe you're looking for a specialist or someone in a certain field. The internet can be a great tool to find healthcare providers in your area. And it can also be great to find insurance information, find providers who take your insurance, or find insurance policies that are more affordable. All kinds of things related to insurance can be found on the internet. We can now use the internet to book our healthcare appointments or to make changes to those. Gone are the days where you have to make a phone call for every appointment that you want to make. Some healthcare providers or facilities may encourage you to do those online now, so that may be something you need to use the internet for. Telehealth appointments have become more popular over the last couple of years, especially through the pandemic of COVID that we have been through. We started to see a greater influx in, checking in with a healthcare professional, sometimes over the phone, but sometimes over the internet through video conferencing. That healthcare professional could actually see you online through a screen, have conversations about symptoms, things like that. And this was a way during the pandemic to provide a safer environment for people to meet in without actually having to go into clinic or hospital settings for minor appointments. You can find prescription medication information online. You might even be able to communicate directly via internet with your pharmacist, or find, cost compare prescriptions and things. We all know that some prescription medications might be quite costly or expensive. So you might use the internet to cost compare those items, or look to see if there's another alternative or a generic brand compared to maybe the prescription you have on hand. We also use the internet to research current health trends and concerns. Again, we were doing this pre-pandemic, but probably especially during the pandemic started in 2020 and ever since, we probably use the internet a lot more to see what's going on. What are they saying about this? Is there a rise in the pandemic? Is it going down today? A new current health concern out in some parts of the world, in some parts of the United States, is the monkeypox. That's, you can hear about in certain things. So you may find yourself typing in your search bar, what is monkeypox? What does it look like? Things like that. So the internet certainly allows us to stay up to date with a lot of current health trends. Again, we can find vaccine information, not just related to COVID-19 or other, more current vaccines, but vaccines that are required for children going to school for the first time, or college students going to college campuses for the first time. All kinds of vaccine information can be found. We can also use the internet to actually pay for our healthcare bills and things like that. Instead of writing a check or going to the facility where you received care and paying a bill, you can get online and pay those through healthcare bill pay portals, things like that. I've done that. Some of you have probably done something similar, and it just takes out that having to write a check or mail in a payment or something like that. So as I just kind of briefly mentioned, a lot of healthcare providers, clinics, doctors' offices now have online patient portals. I know for even local facilities here in the Chester County area, some of the healthcare providers that I have visited, I can get online after a visit and see my chart, can read notes that my doctor, said about my visit or recommendations, all those kinds of things. So if you have access, or if your healthcare provider does that, you might have a patient portal that you can, keep up with your medical records and things through that. And then a little bit more basic, we can use the internet to find healthy recipes. If there's a new diet you're wanting to research, or if you're just wanting to try, lighter recipes or keto recipes or diabetic friendly recipes, whatever the topic may be, you can certainly use the internet to find healthy recipes. And I do that a lot in my job and for myself. You can also use the internet to research diet and exercise plans. You may be thinking about starting a new exercise routine or trying something different. There's videos, a lot of different things you can find on the internet. Some recommended, maybe some not, but they're out there for sure. So those are just a few ways that we use the internet for health or medical related. And you could probably make a whole nother list, but those are just a few to get us started thinking about. So just to continue on, the internet can be a great tool when it's used correctly. And so as we go through this training, that's something I want you to kind of keep in mind. We do want to make sure we're using the internet correctly to find the health information that we need to find good, credible information. So just a few key pointers. Don't use the internet as a replacement for in-person appointments. And what I mean by that is if you have a medical issue, concern, or your loved one does, don't use the internet to try to control the situation yourself. Use it as a tool, but keep those in-person appointments as much as you possibly can. Our healthcare providers and things are there for a reason, so don't neglect and kind of start the self-diagnosing and self-care without consulting, whether it be through in-person or maybe even a telehealth appointment. Don't substitute what you find on the internet for actual conversations with those healthcare providers. The second point, ask for help if you don't have access to, or if you don't know how to get started using the internet. So two kind of things in that. If you don't have access to internet, there's resources where that can be made available to you, especially your public library would be probably the very best place of access if you need to use the internet. And if you don't know how to get started, ask someone who is familiar with using the internet. Hey, how do I, get on? How do I get connected? How do I search for things on the internet? There are people in your life that would probably be more than happy to help you with those things. And again, use your local library and the folks that are staffed there as a resource. And then lastly, learn the basics of identifying credible sources and information, which is a lot of what our training is going to cover today. We want you to be equipped not only how to use the internet to find information about your health, but how to make sure you're getting good, credible, solid information. So starting with that, we are going to use, and I am going to be referring to a publication that came out a couple of years ago that was published by the University of Health Network in 2020 called Using the Internet to Find Information About Your Health. So the University Health Network put together a short document, and basically this next few slides that I'm going to go through covers a lot from that document. So I want to give those folks credit. They did a great job. And some of the things we're going to cover is using the internet to learn about health, deciding if we can trust the health information on a web page, protecting your privacy when using the internet, and learning more about where to find quality health information. So I took just a screenshot of that first page of that document. And if you're listening to this training, I think we're going to be able to make it available to you to either come into the library, the Chester County Library, and pick up a packet of this printed, or I think that these documents are going to be attached along with the training. So you should have access to the full documents. But taking some of that information straight from this document, let's start talking about health information on the internet. There's a lot of good quality information out there, but we always need to be cautious because, as you know, everything on the internet is not true. And it simply could be that at one time it was true, but maybe it's been outdated. Some sources may only be interested in selling products or services. Not every healthcare related website out there is just for information. Some people are wanting to sell you something. And so that's why it's important. We need the skills to find that good quality health information and to be more health literate. And that health literate or health literacy means using different skills to get, understand, communicate, and use information to make good decisions about our health. And so it's important to remember, don't act on any information you find online without first talking with your healthcare provider, because they know the most about your specific health questions. And so that goes back to that key reminder: don't replace health information you find on the internet with actual interactions with your healthcare providers. So how do you get started? Most of us, to find any kind of information, but specifically looking for health information, we're going to use a search engine to get started. So examples of search engines are Google, Firefox, Bing, things like that. And most of us, you might have heard the term, oh, just Google something. Well, that's what that's referring to, is using the Google search engine to get started. And you want to type keywords for what you're looking for versus, very specific. So for example, if I was wanting to find a healthy diabetic recipe in that search engine, I could just put diabetic recipes or healthy diabetic recipes instead of very specific, something along the lines of diabetic recipes for 10-year-olds, things like that. When you use a fewer keywords, you're going to get a broader kind of casting your net, so to say, for more information. And then you'll want to browse through the search results for websites that are well known and reliable, such as educational institutions. And so I've put in just a little screenshot here. If you look at this, I did use a Google search engine, and you can see my keywords that I typed in the box at the very top says diet plans for diabetes type 2. And you can see these are some of the very first results that came up, and it can tell you, it says about 176 million results. Now, that's a lot to go through. And most of us don't go very deep into the research. We just look at the first few that come up. But I want to point out a couple of things. You can see the very first result that came up has this word by it, ad. Okay, so that tells me that if I click on this link, I might have some good information in it, but it's going to have ads. And if something has ads, then most of the time we can believe it's going to be something they're trying to sell us. Might still be good, credible information, but it's going to have that in there. And this is from Weight Watchers, which most of us have heard of that program. We know that that costs money to join. Might be a great thing, not to discredit Weight Watchers at all, but it may not be the first initial thing that you're looking for. So as you continue down the list, the actual first 3 links that come up are all ads. And so the very first link that I would click on if I was looking for good, credible information for diet plans for type 2 diabetes would be this one down here at the very bottom, the 4th result, diabetes meal planning from the CDC, which stands for the Centers Disease Control and Prevention, which I'm actually going to go to their site a little later on. So that's just to show you how you get started using the search engine and how you might want to not always assume that the very first thing that comes up is going to be the best source of information. Sometimes it might, but sometimes you might need to kind of dig a little bit. So how do I know if I can trust the health information I find? So a few key pointers here, again, going back to our document from the UHN, University Health Network. All right, so a few key pointers. If the name of the organization is easy to find, that's a good indicator that we might be able to trust the health information. If it's clear who owns the information and the website, for example, if it's linked to a government organization or a university, a hospital, or another well-known society, it's probably going to be a better indicator that that health information is trustworthy. If there's contact information available, if there's a place, an actual person you can call and talk to or email, that's another sign that it's going to be trustworthy. If the author or editors of the information are qualified healthcare professionals, so for example, if you're reading through an article about how to manage arthritis pain, and it says the the healthcare professional who wrote that article or who reviewed that article is a specialist in arthritis management, then that's probably a good indicator that that information might be trustworthy. And if the website is up to date and updated often, so a lot of your information, articles, things like that, should have a date stamped on them. And so if they're reasonably within date of whatever year you're looking up, then that's also. And we all know that medical information, we make strides in the medical fields all the time, and that's why it's important to make sure the information that you are reading is up to date. Okay, so a few more pointers about how we know we can trust the health information we find. Does the website consider your privacy? And does it have a disclaimer? And what we mean with those two things, does it consider your privacy? Is there a privacy policy that explains how it uses your personal information? If you're going to be exchanging personal information about yourself or your health, you're going to want to know how this organization plans to use that, and you can find that out in their privacy policy. And then does the website have a disclaimer? Does it explain that it's for information only and should not replace seeing your healthcare provider? That's a big red flag, so to say, if it does not have a disclaimer like that. Does the website include an advertising policy? You can find a policy to help you tell the difference between what information is edited properly and what is advertising. The policy explains who pays for the information on the website. And is the website easy to use? Most websites that are put out there with medical or health information know that if the websites they're putting out there are not easy to use and they're not going to be helpful, then they're really going to try to make them more user friendly. So that's a good indication if they're easy to use. So what kind of health information websites should we avoid? Basically, anything that promotes what is quoted in our document here as miracle cures, or as the old saying goes, if it's too good to be true, it probably is. Those are the types of websites we need to avoid. Sites that include ads. And basically, that is, if they're got a lot of health information, but then they have ads within the text that you're reading or a lot of on the website, that's a distraction, so to say, from the health information that you're trying to read. Doesn't necessarily discredit all of the information on the page, but it's just a lot of, like I said, distraction can promote confusion and not really keeping us on task with what we're trying to find out. Sites that require payment to view their information. There are sites out there that are related to universities or medical centers and things that provide their information free of charge. And so just beware, if all you're asking for is information and someone wants to require payment, that's probably another red flag of that you need to avoid a site like that. Maybe consider avoiding sites that don't provide author information, dates, contact information, or privacy policy. And again, without these on websites, it's just harder to verify the accuracy of the information. And then try to avoid sites that are only discussion and based. And what I mean by that is such as forums or discussion groups. They may be a good place to share your personal story and kind of, figure out what others have went through, but they're not usually ran by medical professionals. And so some people might be in the habit of sharing information that's personal and only pertains to them, but not what might be recommended for other people. So how do you protect your privacy? Again, avoid sharing private information on a site, review a site's privacy policy, and don't share your social security number, credit card information, home address, or date of birth. If all you're doing is looking to get good, accurate information, again, there's plenty of reputable sites out there that won't require any of this from you. So if you're getting on a site for just information and it asks you for any of this, the best thing to do is just click off that and find a better site. So in a nutshell, that's kind of using the internet to find information about your health. And the next document I'm going to share with you is called How to Identify Credible Sources of Health Information in the Digital Age. And this is another resource that comes from Oklahoma Cooperative Extension Service, and it is dated 2020. And again, I believe this will be linked to the training, so you'll have access to this document in its entirety. But this is just a snapshot of what the first looks like, and you can see the authors there listed at the top. This is a great, just two-sided document, so I want to give those folks credit. So let's talk about a few of the things of how to identify credible sources, and some of this might overlap a little bit, so forgive me if I don't spend a lot of time on things we've already mentioned. But when you're on a website, pay particular attention to the language and presentation that's used. It should be factual and straightforward language and information. It shouldn't include a lot of drama and emotion, things that might make you tear up. And we certainly know that when we're talking about health and medical things, those things are deeply personal. And so there is a time and place for emotion to be present. But if you're just looking for factual, straightforward information, that's how the language should be presented on a website. And of course, there should be no offensive language or anything that would criticize any particular individuals or anything like that. Look at the time. Again, most websites should have some kind of date stamped. If it's an article written or, somewhere it should say written such and such date or updated such and such date. And so current sources should be, considered within a 10-year time period is what this document by Oklahoma Cooperative Extension recommends. So anything, we're in 2022. If I'm looking up medical information from 1992, then the chances are, that there's more current data out there since 1992. However, I will say in certain instances, there is no new research on a topic, so some older sources may still be credible. That's not to say that they're completely infactual, but just try to be in the habit of making sure you're finding the most current medical and health information that you can. Okay, and considering evidence. So there should be evidence on a website that lists references. So for example, an author should provide evidence to support any claim being made. So he or she should be able to back up their evidence with references, whether it be studies that were done, experiments conducted, anything like that would be considered good evidence. Okay, we also need to look at potential bias that might be found on a website. And biased sources will slant information that is shared. These sources try to change the mind of the reader instead of presenting facts. So if you find yourself on a website that seems very opinionated, consider that the source might have some kind of bias attached to it. Good, bad, in between, just consider that. So biased sources may use strong and emotional words like everyone knows or people say. Language like that is an indicator of bias. All right, let's talk about expertise just momentarily. Whoever is responsible for the site, the author of the site, should have schooling or formal training in whatever the topic is. So for example, this document by Oklahoma Cooperative Extension Service specifically gives examples. Nutrition advice should be provided by someone such as a registered dietitian, or medical advice should be provided by a medical doctor. Things that we are just kind of common sense is what we need to keep in mind. If their background is not provided, try to find more out about the author and see, do they really have the expertise to be giving factual information on a topic? And then let's talk about cherry picking. Okay, cherry picking is basically choosing information that confirms the reader's belief without looking at the other side of the story. So this leads to avoiding quality evidence that may be right, but that contradicts the reader's belief, and it can lead to confidence in a topic despite evidence against it. So cherry picking and bias are kind of related like that. So let's talk about sites that are considered more reliable. These are going to be your informative websites, the websites that kind of end in the .edu, which means they're from an educational organization, or .gov. So these are usually unbiased. They're going to have more factual information. They're reviewed by experts in the field, and so on. Advocacy sites could be considered a little less reliable. They may tend to have a little bit more biased information within them. These kind of are the websites that end in .com or .net or .org. Still could be very, very good, credible information, but you might just have to be a little more careful on these sites to make sure the information you are finding is accurate and factual. And then blogs and social media would be considered to be some of the less reliable or least reliable sources. Again, not to say they're totally discredited, but you're going to want to be a little bit more specific in the information that you're gleaning from these sites. So with blogs, they tend to present information in a one-sided fashion, leading to misrepresentation. And social media is kind of the same way. Basically, because anybody can get online and create a blog and social media about anything that's out there. You know, if I wanted to get online and start a blog about how to manage high blood pressure, I could do that. And I could put in all the information that I think I know and put it out there. And then there's nothing to stop anybody from coming along and thinking that, oh, this blog is easy to read. It has a lot of good information in it, and it might have good information, but I'm certainly not qualified to write a blog that's factual about managing high blood pressure without doing my research or having it supported by someone who does work in the medical field. So those are just examples of how we need to be careful with social media accounts and blogs. So basically keep the gold standard in mind. And when it comes to the gold standard, again, I'm acknowledging this document from Oklahoma State University. The gold standard is for something to be peer reviewed, which means that articles have been written by experts in their fields, and these articles are reviewed by other experts, their peers, basically, before being published. And there's a process that is put in place to make sure the information is high quality and unbiased. All right, one more document that I want to share before we get into looking at some specific websites. And the name of this document is Take Time to Care Before You Share, How to Avoid Spreading Misinformation. And this came out, this was a joint effort document put together by the University of Arkansas Extension and Purdue University Extension. And again, I've provided you just a snapshot. This is just a front and back page. It's great information on it. Some of it overlaps again with things we've already talked about. But up to this point, we have talked about kind of from the standpoint of finding health information for ourselves. But sometimes we find information and we're real good as human beings to want to share the information we find. So we just want to make sure that we don't spread misinformation, especially health misinformation that might in the long run cause harm to those that we share it with. So looking at this, I don't have additional slides. I'm just going to refer just a few notes from this document. And remember, I believe these documents will be shared today, so you should be able to look back at this in its entirety. But kind of scrolling down, what is the source of the information? Again, determine if the author is a real person and their credentials, what makes them qualified to give information on a certain topic. Is it a reporter, columnist, or editorial writer, a blogger or paid content generator? Their role can be a clue about the intended impact of the information. If it's a social media account, has that account been verified? Does it really belong to who we think it belongs to? Consider looking at the original source of information to see if any details changed or were left out to alter its meaning. And this is the section I really want to point out. You can kind of see on the screen here, that bottom section. It says, have you read beyond the headline? Now, I think most of us that are social media users are probably very familiar with this phrase, and you may have heard someone say it, or you may have even said it yourself a time or two. But an example of, I saw something on Facebook the other day. Well, I didn't read the whole article, but the headline said such and such and such and such. You've probably heard that. You've probably maybe said it yourself. That's okay. Our intentions are good when we try to share information, but it's very important to read past any headline before sharing the headline you read as fact, because we often know the headline does not tell the whole story. So you're not getting all the information from just reading the headline. Slow down and read intentionally. If you find something out there that strikes your, attention, gets it, read the whole thing in its entirety. Just scrolling through content can lead to information overload, and that can prevent us from really understanding what we are trying to read. I'm flipping to the next page, which I don't have a screenshot of, but I'm just going to take a few notes from that. Does the author or platform have an agenda to persuade you for political, financial, religious, or other reasons? We all know, and this discussion, I certainly do not intend it to be political in any way, but we all know that there are celebrity figures, political figures, all kinds of people who give an opinion, their opinion about information, and it is meant to persuade others to change their mind or to agree with them. So just keep in mind and ask yourself when you're reading, what is the mission or purpose of the author or publisher? Okay. Is what you're reading news satire? Okay. News satire is a type of parody presented in the same format as typical of mainstream journalism, and it's presented in a way that it could be confused with actual news. So there are some things out there that are printed that, if we're not careful, can be taken as factual when they're not necessarily meant to be. And just a few other things from this document. Reader habits and the availability of more space on the internet have changed how some media outlets write headlines to grab your attention. And so this phenomenon is called clickbait. And so basically, you know, are they writing or phrasing that title in a way just to get your interest, just to catch your attention? And clickbait can be entertaining, but it may not be a reliable source of factual information. Okay. So, and the document goes on to ask, have you checked your own biases lately? So there's a good little snippet you can read on that when you have access to the full document. So we've talked about how to identify some sites. I want to go through a couple and just to see if we practice. So I'm going to click, and hopefully this goes to our first site. All right, so this site is called Noom. Noom is a for-profit organization. It deals with weight loss and things like that. And so right away, you know, this website looks nice. It's very presentable. But what it tells me is, you know, there's things across the tab here, products. It automatically tells me they have something to sell, okay? Which again, does not necessarily stop me from looking on, seeing what information they have, but it just kind of lets me know that what their main intentions are, okay? Again, not necessarily bad, but just they are a for-profit, for-business company. So that may not be exactly what I'm looking for. So let's look at site 2. And these sites, I believe, are related to healthy eating. Yes, that was the information that I had in mind when I tried to look at those. So the second site that I did find information on was from the Mayo Clinic. Now, if you've never heard of the Mayo Clinic, it is a very well-known series of clinics that publish information. And so you can see there are ads on here. Okay, that's, you know, websites do cost money to put up. So even places like Mayo Clinic might have some ads to help offset the cost of their websites. Okay, but you can see here, and someone had asked the question, what is, or labeled the title of their article, what is intermittent fasting? Does it have health benefits? And so scrolling down here, you know, we have an answer from an MD. Doesn't tell us a lot more about this person. So we might go back and see if we can find information about them. But we do know there is some information here, and we could read through it and just kind of, you know, is this credible? Can we compare it to other things out there? And that would give us a good start. So let's look at a couple more. Okay, and just to give you some background, I wanted to find some information about monkeypox. Okay, so I want to show you, this is a news site, BBC, credible news site. It's been around a long time, and I don't know if you all can see this blue box that popped up. It did with me, but it says news you can trust and news you can use, and it wants me to register. They want me to share my most likely email address and things like that. Again, not necessarily a bad thing, but this would be information, you know, that is going to have a lot of ads in it. because they are news. Obviously, they have to pay. I have all these pop-ups as I scroll down coming on, okay? When all I really want to do is find this information about monkeypox. So, doesn't necessarily mean that this information is incorrect, but there's just a lot of distraction on this page for me for what I'm really trying to find, okay? So let's look at the next site, compared, okay? Let's see what it brings up. Okay, so I saved a web page from Johns Hopkins Medicine, okay? Probably all heard of Johns Hopkins Hospital, things like that before. And now I can read through here about monkeypox. It tells me it's an infectious disease and that it was updated as recently as August 12th, 2022, okay? And look how much easier it is. It could be the exact same information that was on the BBC page, but look how much friendlier it is to read. I don't have as much distracting me. I can just get the facts that I want. It lists the medical professionals here who have done research, things like that. So this would be a much more credible and user-friendly site to use. So just some examples of using credible sites. Now, I want to go through in the time that we have left. We are quickly running out of time, so I do encourage you to read back through some of these documents and things that I've shared. There are resources that your library system has shared, and I'm going to go through some of those. Tennessee Electronic Library. So you can use these sites specifically to find health information. I think I want to click on this one, this health and wellness, and use this resource. And I have a list that will be attached to this training of all of the websites that I have today. So if I won't get to cover all of them in detail, but I do want you to know that they'll be available. So the Gale Health and Wellness website, you know, if there's, I can just come in here, I can type in something specific that I'm wanting to research, or if, you know, I'm just wanting to know something more about aging, I can come and click on that. Or if I want to know more about dementia, I can click on those. And these are all websites provided by the Tennessee Electronic Library, okay, which great source. So I'm going to click out of that. And these are overlapping sources, so I'm not going to necessarily click on each one of these just for sake of time. But there's also we started at the Tennessee Electronic Library and actually ended up on the online health resources. There's training guides on how to use these resources. The one file collections and the Medline Plus kind of also go along with those libraries. I am going to pull up the Medline Plus. So I like this information. It tells you, you know, you can just read on a wide variety of health topics, but this is from the National Library of Medicine, okay? So that kind of tells us it's from a big credible source there, and it's going to have a lot of information. Okay. One website I want to show you specifically related to nutrition and healthy eating is called MyPlate. I use this a lot for educational purposes. It's actually called myplate.gov. It is ran by the USDA, U.S. Department of Agriculture. And if you're not familiar with MyPlate, you might be familiar with other things that came out in previous decades from USDA, like MyPyramid or the Pyramid Food Guide. That was before that. And they're just the standards that USDA researches and puts out for recommendations for how we should eat, nutrition, things like that, specifically the dietary guidelines for Americans. You can look that up. You can learn about all the different food groups. You know, you can, if you're in the stage where you have young children, you can find out, well, how much does my toddler need, you know, of dairy, or if you're an older adult, how many servings of protein do I need a day? It is so interactive. I really recommend this site to anybody that's looking to eat healthily. I particularly, like I said, like these life stages, whatever life stages you're in, or you have family in, you can click on these and you're going to get tons of information related to healthy eating practices for those life stages. So My Plate is definitely one of my favorite resources. And I apologize, we don't have time to go through every single one of these. So I'm going to just click on the ones as of right now that I'm most familiar with and that I would recommend you use. Again, Diabetes Food Hub. My background and what I do is a lot of nutrition education. So I like these food websites and they get me inspired to make healthier choices too. And so I hope they will for you. And whether you have diabetes or not, this is a great place just to find new recipes. And I like to click on the browse recipes. And then I like this filter recipes option. Okay. If I want to come in here and I'm looking for a healthy, let's see, I want to make budget friendly. Let's see, that's a good option right now. And I'm looking for budget friendly, quick and easy. That sounds good, right? So let's click on those. And because I have those two things checked, it's going to bring up things that are budget friendly and quick and easy. Okay. And it tells you, for example, this beef and broccoli over zucchini noodles takes 15 minutes approximately to make. Same with, you can just scroll through here, this chicken nacho casserole, 5 minutes to put together, 25 minutes to cook. So this is a great recipe. And even if you're not diabetic, what I have told my clients before, getting in the set of mind of eating healthier, maybe diabetic friendly recipes is going to be beneficial to most everybody. Centers for Disease Control and Prevention. This is kind of the, saying can't, okay. So I'm not sure why we're being deterred from that site, but CDC, I might have a typo in there. Okay, I apologize for that. Basically, the cdc.gov is the American standard for any health related topic you can think of. So I would encourage you to make that one of your go-to resources, as well as the Mayo Clinic, which I've already brought up a site. So for time's sake, I'm going to move to it through a few others. There's the National Cancer Institute. So, if someone or yourself wants to find more information about cancer, this may be the place that you want to go to. Okay. It has all kinds of different topics through here. National Institutes of Health. This is kind of the overall website for a lot of these different ones that are going to be listed after the National Institutes of Health. It's going to have basically branch off topics about a lot of different things. So I could probably spend a whole hour just going through all the things that it offers. And the National Library of Medicine is connected with the National Institutes of Health, so that's just another resource. The U.S. Department of Health and Human Services, and I will say your state, as for Tennessee example, would also have a website of Health and Human Services related directly to the state of Tennessee. The National Institute of Mental Health, okay, would be an example. Another one of those that's linked to the National Institutes of Health. Sit and Be Fit. There's all kinds of exercise information out there. What I want to say about any exercise information or videos you're looking at, it's always a good idea to talk to your healthcare provider before you start a new exercise routine, particularly if you have any chronic pain or chronic illnesses. You don't want to worsen any body condition that you may already have by starting an exercise routine that's not appropriate for you. So if you're not sure, always have those conversations with a healthcare provider first. So I like this website, Sit and Be Fit. It's kind of unique. And it's kind of geared towards seniors or older adults, and it's chair exercise programs. And there's things on here, free resources. It gives you an about, articles you can read, all kinds of different things that you can find on there. Okay. A few others that I like, and these would fall under that advocacy websites that we talked about. But if you're looking specific for information, there's some really good sites out there related to diabetes, which is one of the more prominent chronic illnesses that Americans face, is diabetes. This is kind of the go-to hub for sorry for the pop-ups, for information on diabetes. Okay. Now there are things in here that you can probably buy or share your information. Again, that's not to discredit the information on here, but it's just, how this site basically generates income and things to keep this organization going. Okay. It is an advocacy site. Same for the American Heart Association. I like the American Heart Association. I use it a lot for information like during February, which is National Heart Month. Um, how there's things on here, articles, how to control blood pressure, understanding cholesterol, all kinds of different things. You can find recipes, heart healthy recipes on here. Same for Arthritis Foundation. Arthritis is another chronic illness that a lot of people in the United States live with every day. So this is kind of the hub for, finding out about arthritis, living a healthy life with arthritis, learning about juvenile arthritis. So all kinds of different things there. Just a couple more. One I like is BMI calculator. This is a tool that you can use to determine, basically according to your height, weight, and gender, if you're underweight, at the appropriate weight, overweight, or obese. And if you just go into your search engine and type in BMI calculator, you're going to get tons of results. So I do say try to go with one that is reputable. Again, this is, the National Heart, Lung, and Blood Institute, and it's a service of the U.S. Department of Health and Human Services. But basically what it means by having a BMI calculator, it should have something like this, where you can type in your actual credentials. So I'm just going to make up something in my head. If we had a 6'2" person, and this one does not consider if you're male or female, but you really want to use one that probably does consider if you're male or female. So let's just say we had a 6'2" person and they weigh 230 pounds. It's going to compute your BMI. Your BMI for this person is 29.5. Okay. So that would go into the overweight category. Okay. Now, this is, again, not to replace information from a healthcare provider, so to say. Okay. But this is kind of a basic tool that can be used to determine, more than what your scales say or more than what you see in the mirror. This just gives you some actual numbers to work with. And again, I would try to find one that asks also, are you male or female? Okay. And if you're not comfortable doing this online, ask your doctor at your next physical or your checkup, hey, can you calculate my BMI or my body mass index? All right, and then because I do work for the University of Tennessee, I do want to share some information that pertains to UT. As I mentioned at the beginning, I am a UT Extension Family and Consumer Sciences agent. And so we have a website that I want to share with you all. And this is what it looks like. And it has several different topics on here. Our top professionals in every county, I do want to say, if you live in the state of Tennessee, every county in Tennessee has at least one family and consumer sciences professional. Okay. And these professionals use research-based education to help Tennesseans gain knowledge and develop confidence in making good decisions today and tomorrow. And these are the particular areas that we work in: family, food, health, home, and money. So since our training for today is based more on health, I'm going to click on this. We help people make healthy choices, manage health conditions, and create healthier environments. So if I click on this health tab, it's going to take you to some of the things, how we can help, you manage your health. And you can click on county extension offices. and you can click on the county that you live in. So let's click on Chester County. It's going to take you to the Chester County website. It's going to have our time and office hours on there. You can get directions, all kinds of information on there. Let's see if we can go back a tab. I don't think it's going to let me, so I'll start over this way because I want to go back to show you a few other things. But basically, you can use this site to find out what classes are being offered by your extension office, what health related, things that you can learn. So you may not find just a ton of actual information for reading purposes on these, but you can find out about some of the programs that we offer. For example, we offer in some counties, now I will say every county is different in what they offer, but this particular program is related to cancer, and it's called Thriving and Surviving. And so it's a 6-week program that teaches cancer patients and their families skills in dealing with the treatment and survivorship phases of the cancer care continuum. So those are just some examples of things that you might be able to find through your extension office in your county. All right, and then one UT Medical Center. Now, the UT Medical Center is located at the other end of the state, so I'm not necessarily promoting use of the UT Medical Center. I know we're here, most of you viewing this training are probably here in West Tennessee, but what I did want to point out is when you need a medical center or a healthcare facility, get online and read about their services, their doctors, what they offer. A lot of times I have heard friends say, oh, I chose such and such healthcare provider because someone recommended it. And that is great. We use recommendations and things by people we trust. But in the age we live in, we can go another step forward and we can actually get online and research not just an actual medical center or a clinic, but the healthcare professionals and services that are there for when we might need those. So keep that in mind. All right, well, since we are online, I won't have any questions, but I hope that if there's anything that you do have questions about, you'll review this training again, or, research some of those documents that I shared. And thank you very much for listening today. I appreciate your time. I start playing and there's nothing. So I was like, are you kidding me? I was so mad. Okay.